Welcome back to stage 3 of Accuro, the EMR system. So under the EMR icon again, we have another video pertaining to uploading documents. Now this time we're looking at lab requisitions. So imagine as an MOA, we need to produce or create a lab requisition for a patient for an upcoming surgery. And so the way we can go about that is, again, we bring up our patient. So Albert Zargar needs a requisition. We now proceed under encounter notes. So we go back to encounter notes and the drop-down menu. We once looked at the left-hand side for particular notes or progress notes and letters. But now on the right-hand side, we see different forms. These are all requisitions. These can again be customized depending on the type of clinic that you're working at, but we're here for academic purposes. We have lab requisitions here. We have ones that pertain to child development as well as hospital requisitions. Now, the most common requisition used in a clinic is the MOH lab requisition blank. There's ones for diabetes and HIV as well, but let's look at the blank one. So we double click here and we see a very common requisition for Ontario, so the Ministry of Health and Long-Term Care. This is a true requisition, and of course for academic purposes, the information is false. So here we have the doctor's information, name and address, their practitioner or clinical or clinician number. We also have the patient information that automatically gets populated because we are on that particular patient. There is some information perhaps we can fill out if we need to. For example, if there is a virgin code or if the male or female needs to be checked off. So here we check off male. And we also check off whether it's OHIP, third party, or WSIB. Usually it would be OHIP. So we would check OHIP off, and we need to fill information according to what is given to us. So what does Albert need to be checked out for in order to proceed with surgery? So randomly, I will choose, for example, glucose that needs to be under fasting. There's sodium that needs to be checked, his potassium levels. Let's also look at urinalysis chemical, the CBC. And I think that's good enough for now. So these are what the kind of things that we would check off according to what this patient requires. And in order for this to be a valid requisition, we need it to be signed by the provider or the doctor. You can choose to provide an electronic signature, or you can print it and have the doctor sign manually. Many doctors prefer to have the electronic signature. Make sure that it is dated, and we can now print the requisition for the patient and send them off in order to get the following blood work and urinalysis and so on and so forth completed. Again, if we click OK, we have now uploaded this requisition into the patient's file. If we ever do need to review or edit anything, we double click and the requisition appears once more. Now, if we do need to delete the requisition, we could always right click and proceed to delete. And that is how we create and upload a patient requisition into their file.